So next we're going to do the confrontation visual field exam. So the idea here is we want to see what the peripheral vision is like, and we're going to use our peripheral vision as the reference standard for that. Now there's a couple of ways that people learn to do this. Typically in a neurology rotation you're going to have the patient looking with both eyes open because you're looking for visual field deficits that are usually bilateral. So you're looking for hemianopsias, you're looking for quadrantic defects that are in both eyes. So oftentimes you'll see the neurologist coming up and saying, okay, I want you to count how many fingers you see here. You know, add them up for me. Add them, no, keep looking straight. Add them up for me. You know, can you see my fingers? Can you see my fingers with both eyes open? You will not see that happen in an ophthalmology clinic because typically we're seeing patients and we're looking for eye disease, not necessarily brain disease. Now sure, you want to make sure you rule out brain disease, but we will usually check confrontation fields with one eye at a time because typically if it's in the eye, it's going to affect one eye's visual field. If it's in the brain, it's going to be symmetrical with both eyes. So here's an example of confrontation visual fields for one eye at a time. So well, actually you can cover your eye. If you want, you can even cover the person's eye. And then essentially, the patient will cover their right eye. You will cover your left eye. And that way you're both comparing the same visual field, okay? And you'll introduce your finger at the midway point between you and the patient peripherally in each quadrant. Now you can use whatever stimulus you want. If you say, you know, how many fingers am I holding up? Can you count? No, keep looking straight. How many fingers am I holding up?
2.
And now how many fingers am I holding up?
1.
So that's a gross measure of those two quadrants. And now how many fingers?
1.
And now how many fingers?
1.
Now how many fingers?
2.
Okay. Or you could introduce a stimulus and say, tell me when you see this. So tell me when you see this.
It.
Tell me when you see this.
See it.
Tell me when you see this.
It.
Tell me when you see this.
See.
Now say they couldn't see something that's quadrant. I would be seeing my finger at this point, and they might say,
Okay, now I can see it.
so that way you know that this whole area is missing for them. So again, you're using your visual field as the reference point. Now if you have an abnormal visual field, this test isn't going to work so well. Here are some of the common pitfalls that you might see. So tell me when you see my finger.
I can see it. I can see it now. I
Yeah,
can see
that
it.
is not testing his visual field. Again, he's moved his head, right? So make sure you keep your head still and tell me when you see my finger.
Okay, now I can see it.
Perfect.
See it?
Much better. Okay, so that's common pitfall number 1 when they move their head. The second thing that sometimes can happen is if your hand is closer to them than it is to you, your finger is going to appear sooner to you. So oftentimes what we see is people will be standing way back here and they might say, okay, well tell me when you see my finger, and you see it quite clearly but they don't. Or your finger's over here and you can't see it but they can. And that's going to skew your visual field as well. So you got to make sure that your finger is halfway between where you're introducing it so that you each have an equal shot to see it. Tell me when you see my finger.
Okay.
Perfect.
See it?
And always remember to check both eyes. So cover your other eye and look straight into my eye. And tell me when you see your finger.
See it?
Tell me when you see my finger.
See it?
Perfect. Tell me when you see my finger. And tell me when you see my
I see
finger.
it.
So there we have checked the confrontation visual fields in both eyes.